All right, let's read today's question. Do insurance companies, example Blue Cross, ever approve more than 36 sessions for patients who are slow responders? And if so, what criteria do they generally have for approving or denying course of treatment longer than 36 sessions for MDD? Okay, all right, I'm Dr. Bawarshi from Florida TMS Clinic. I answer questions about TMS. If you have any question, you can put it below or send it our way through our website or via email address. All right, so this is a common question. Technically, first we have to clarify the number of treatment sessions that are FDA cleared and generally approved by insurances. That number is actually 30. So you can do 1 treatment session a day, 5 days a week for 6 weeks for 30 treatment sessions. Now, also you can do 6 treatment sessions of taper off. So the total number becomes 36, right? But you cannot really do taper off if the patient did not respond to the acute treatment of 30 treatment sessions. So that's a little bit of a misconception, because there is one company that is very large and all over the United States of America who would do 36 treatment sessions for patients regardless whether they responded or not. You know, they cannot do the taper off of 3 sessions and 2 sessions and 1 session if the patient did not show a response in the first 30 treatment sessions. That's basically the policy of every insurance and the LCD criteria for Medicare. So they're at a little bit of a violation in there in case that somebody wants to audit or review what's going on. But anyways, back, the answer to the question is, it's very difficult to convince insurances of extending beyond 30 treatment sessions. But before we go to insurances, let's look at the science and see what are the data and research published that supports going more than 30 treatment sessions or not. There have been actually data showing that if we extend the treatment sessions and we double the amount of sessions to 60 treatment sessions, we could pick more patients out of non-response to response. So that we know. The problem though, that is the effect size, like how many patients we're picking compared to how many we picked with 30 treatment sessions, is not as large. So for this reason, insurances would like, okay, cost effectiveness wise, it doesn't make sense to go beyond 30 treatment sessions. Do not go beyond 30 if somebody did not respond. And obviously if they responded, then you can do 6 extra sessions, not to pick more improvement, though some patients could pick more improvement during those 6 sessions. It's more for taper off to increase durability, meaning to decrease the chances of somebody relapsing after that point. All right, now, so what do we do in real life kind of situation? What if somebody is a late responder? You know, they started responding beyond the 20th session, like in the last third of their treatment. So one thing is to actually, you know, ask for prior authorization for more sessions. Automatically, it's going to be denied by insurances. They're going to offer peer-to-peer, so the doctor will talk with the doctor from the insurance company to explain what's going on. If that doctor from the insurance company is a reasonable person who knows TMS well and who does understand the pieces of research that we have, and that person does recognize that this patient is a late responder and we could actually pick them, you know, bring them to better response or even remission, then they might be extending. They usually would not extend for the whole 30 treatment sessions. They might extend by another 10 sessions or something of this sort. That being said, this is a rare thing to happen. Most doctors who are representing insurances, they're going to stick to the policy and they're going to say, I'm sorry, you know, this is not working for your patients, you know, just go for the next thing. When this peer-to-peer is denied, the patient themselves can appeal that decision, and they can request from their insurance review of such a clinical research to actually extend their treatment beyond just 30 treatment sessions. But that's a step that is taken by the patient. And usually insurances will be scared of a patient, you know, and then they would listen to them because, you know, they could claim that there's a conflict of interest if the doctor is saying extend, but they cannot say the same thing if the insurance is the patient asking the insurance for such an extension. So I do know a patient who had been approved for longer than 30 treatment sessions. It was a lot of hassle for that patient to get that approval. And it wasn't our patient, she was transferred from another state, and that's how I know about it. What do we do in my practice? In my practice, if I find that there is a patient that could benefit from extending their treatment beyond 30 treatment sessions, we just do it. We don't charge patients, you know, we don't submit it to the insurance. As you can see, there is so much headache that goes into trying to get insurances to pay for those extra 10 sessions or 20 sessions that I decided I want to throw in to kind of help the patient have the optimal response that they have. And I don't have the time to do that. I'd rather spend my time, you know, taking care of the patient rather than, you know, chasing insurances for a penny here and a penny there. So that's how we do it in our clinic. Hopefully that was a good answer. If you have any further questions, you know how to submit them, and then we will be able to help answer those. All right. Disclaimer: although I am a psychiatrist, this is not a professional advice, as I am not familiar with the specifics of your unique situation. Please contact a psychiatrist in your area with more questions. This disclaimer is added to my answers on social media after consulting with the American Psychiatric Association. Thank you.